everyone, I am Dr. Supritha Rangaswamy, consultant gynaecologist and obstetrician in Cloudnine, Thanisandra, Bangalore. Who is at risk of endometrial cancer and how to get screened? So, as you all know, there is a universal screening program for cervical cancer, whereas it is not for the endometrial cancer. Endometrial cancer, there are certain set of people who are at high risk for the endometrial cancer. Firstly, obesity. Obesity is a major risk for the endometrial cancer. Next is the PCOS. Any female who is having the PCOS, they should get evaluated, they should get screened for the endometrial cancer as the age progresses. So, why is the PCO in risk for the endometrial cancer? Because in the PCOS, there is no ovulation. So many follicles do grow and it would not ovulate. In that case, the endometrium keeps growing without the progesterone and only high estrogen levels. The high estrogen level is a major risk factor for the endometrial cancer. Hence, if you have not got periods for more than 3 months, it's ideal to take a withdrawal, go meet your gynaec and take a medication and see to that you will get periods at least once in 3 months. So, other risk factors include Tamoxifen. Tamoxifen is a medication given for the breast cancer. So, in the breast cancer, the Tamoxifen acts as an anti-estrogen, whereas on the uterus, it acts like an estrogen and it increases the risk of the endometrial cancer. And if you had a history of previous breast cancer or ovarian cancer and the history of the endometrial hyperplasia, these are all the risk factors for the endometrial cancer. Now coming to the screening, how do we do the screening in case of the endometrial cancer? Any female who have the risk of the endometrial cancer should get screened once in a year. The first screening modality is the scan. Transvaginal scan would be done to see the endometrial thickness. If the thickness is too much, then the endometrial sampling would be done, which would be seen under the microscope whether to see there is a endometrial cancer or just a hyperplasia. So it's always better to get evaluated high risk of the endometrial cancer.